We know that a disproportionate number of people from Black, Asian and minority ethnic communities in the UK are detained under the Mental Health Act each year. A new white paper, Reforming the Mental Health Act, sets out the government's plans to tackle this and other issues arising from this current law, which hasn't been updated since 2007. So what I want to know from you ladies is, do you think reforming the Mental Health Act alone is enough to tackle these racial disparities?
I would probably lead by saying, I don't think so. I don't think it's going to be the only thing. I don't think Black and brown people are disproportionately represented in mental health hospitals or services just because of the act. I think there needs to be a holistic approach to this whole thing. So looking at poverty, number one, because people who live in poverty are 3 times as likely to be sectioned or detained. I think they need to look at opportunities, schooling and education. I think there's just so many things that need to be looked at in order to tackle this problem. So I really hope that this reform or these recommendations, because it's not saying that they're going to do them, they're recommendations to change the act. I really hope that it looks at everything surrounding mental health in Black and brown communities.
Yeah, definitely. I definitely agree with you, Sophie, on that. I don't think it's going to stop it. I think there's more that needs to happen. I'm thankful for the recommendations because I think it at least gives some sort of acknowledgement that things haven't been right for people of color in the communities and how we relate to mental health. So I like the recommendations. However, it's not enough. And I think I was reading one of the articles and a professor, I can't remember his first name and his surname. I feel like I'm butchering it. I want to say Bowie. I just gave a general sound, but you feel me wherever you are. We're here. He was saying basically that with the reforms and the recommendations that they've made, it would reduce, I guess, general numbers of people of colour being detained by the Mental Health Act or by CTOs. However, that racism in this industry would show up in a different way. And he was like, because the bigger problem is like it being in the system and systemic. And I definitely agreed with him when he said that, because it's kind of like, you know, you cut one head off and another head grows. This is the kind of racism that's not the in-your-face racism, like I'm going to call you a slur, but it's one that's kind of like ingrained and interwoven through the system, the structure, the way that they relate to us. So a one-stop shop isn't like the one thing isn't going to fix it. It almost needs like everything needs an overhaul so that we can have equality. But then you have to ask yourself, is that even possible?
I completely agree with you both. I think it's definitely a step in the right direction, and it's a step that we've needed for ages. As we said, it hasn't been updated since 2007. But is it enough? No. I think we've got to look at the reasons why people in these communities are getting to the stage that they need to get detained. We need to go right back to the start. We need to improve access to the right therapies and the right supports to these people. I think we've seen over the last over a year now that there just aren't the right sort of support set up for people in Black, Asian, minority ethnic communities. When I am like feeling low and want to talk to someone about it, I want to talk to someone who looks like me. I want to see these people in places that I can access them. And I think as someone who, you know, I live a very sheltered life. I live in a lifestyle that can support me to like find these people, but there are people out there from these communities that often can't. And I think that's somewhere that we really need to focus on and start. Secondly, I don't know if you guys remember, but there was a man called Kevin Clark who died in 2018. He was diagnosed with schizophrenia as a teenager, and he was living in support accommodation, and he was having a turn and he was having, you know, a mental health on a decline, and police were called out to deal with him. And instead of, you know, approaching the situation in a way that could really help him and make him feel secure and safe, and whilst he was going through this, they restrained him, they handcuffed him, and they dragged him to an ambulance. And this video was plastered across media outlets. So I think we have to remember that you know, A, I'm fed up of seeing this trauma. B, we need to stop this trauma from happening. We need people in positions of power like this trained to deal with these situations. And I don't see that anywhere in the white paper. I don't see that in their attempt at reforming the Mental Health Act. You've got people on the front line who aren't equipped to deal with these problems. And yeah, I think this needs to be more of a holistic approach, like Sophie said.
And I think it's so interesting what you're saying. Like, it hasn't been updated since 2007, but it's been in place for 40 years in general, I think. And I laugh because it's so ironic and ridiculous, the fact that we've been knowing that Black and brown people have been detained disproportionately, illegally, wrongly for decades. For decades, this has been happening. And now when they're like, oh, we want to address it, people are like, yeah, but this has been happening and you've been turning a blind eye to it. And people who are being detained who aren't even suffering from mental health issues, like people who have autism or learning disabilities, and that has also been grounds for somebody to be detained. So I think it is a long time coming, and I think, as Anissa said, they definitely get props for wanting to do something about it, but the way that they're currently looking to do it is a bit, it makes you wonder if there's going to be lasting change, because I think one of the reforms is that more work is going to be given to people who are already dealing with this on the front line. And we're like, well, actually, you need to be putting in the infrastructure and the financing to make sure that people can deal with the additional paperwork that's going to come with making sure processes are done better. And at the moment, the government's saying, you know, they're going to do their best, and when funding, or if funding, or they'll try and see if funding can become available. And with that sort of talk, it's like, it makes you worried about how long it's going to take to actually see change.
Yeah, it definitely does. And even just like, I was listening to you, Sophie, and just really thinking about it, because when you touched on a lot of people also being wrongfully detained, and simply for things like learning disabilities and autism, it's kind of just like that. For me, like, Black and brown communities already have a lot of trauma, just general, okay, whether it's generationally, day to day, anything, like, we pick up and carry lots of trauma. It's just what we have. And mental health in these Black and brown communities have been stigmatized, and so we already go through it, I guess, amongst ourselves. And then if the professionals can't even either diagnose us the right way or mistreat us when we're trying to get help, it just makes it feel very disheartening. Like, I can't explain, like, just listening to that, it just makes me feel really disheartened. Like, how can we have change? We need more funding, and we also need more mental health services readily available, but the right ones readily available for the people in the Black and brown communities. But it's always kind of like the whole money thing, like, oh, will you get funding? Won't you get funding? And most of the detainees, I was reading where it was the highest amount of detainees are in deprived areas. So for me, it's already like those areas have already kind of been abandoned a bit, because they're lacking funding in so many other places, just generally outside of health services. So I feel like the government, saying like their government, but I feel like the government does need to put more weight on these areas. Not saying that that everyone shouldn't have the privilege of mental health services, but I think there needs to be an emphasis for people in these communities, like the right ones.
I completely agree with you. I think it will be so long until we see results from these changes and see what actually comes from this, because they're throwing money at it and they're saying that, you know, we're going to give people in these situations more autonomy over their treatment, but the waiting list to even get treatment is absurd. Are you even going to get the right treatment once you get there? I just don't see, I just really struggle to see how they're going to make the changes that are needed by the time that it needs to be done.
It's so true. Like, I have an eating disorder, which is classed as a mental health disorder. And when I've gone to the NHS looking for support or help, like, I've got some really great help from the NHS. I do want to say that. And there are people there that care. There is just a big lack of underfunding. But they told me it can be 3 to 6 months before anyone sees you. So if you're waiting to go and get help when you're going through a crisis, because most people don't go to the doctors when they're feeling well. They go when they're feeling down or upset or something's broken. And if people are going in a time of need and then they're put on a very long waiting list for mental health support, you can see how things kind of get out of control and how people can be left in the lurch, and then someone's waiting, months to get help, and then suddenly you're detaining them because they have an episode. It's like, what did we expect was going to happen? So, yeah, it's a lot.
It's definitely a lot. And I think there's also a bit of a fear, like just even touching on from Lauren's story about the young man who, sorry, just the story has bleeped in my head, but obviously they killed him, right? Am I right? Just remember?
Yeah, he later died in hospital in police custody.
Yes. Yeah. It just reminds me of a story that I heard last week about, this was in America, mind you. However, I feel like, Black and brown communities everywhere are always, suffering in some sort of instance, about a pastor. He was having an episode at one of his family members' house, so they called the police to get some sort of mental health services or whatever to come and help him. However, the people that they sent weren't trained in mental health, and so when they got there, he was having his episode, and then they just shot and killed him. And it's just this idea of people not knowing how to manage when Black or brown people have these are having mental health issues, and it just shows you it's not even just like a UK thing. I think it's like a global issue.
Yeah, I saw in like Community Care magazine, they had some really great information on this, but one of them was saying, until we tackle racism in society, the recommendations aren't going to do much, because we're still going to be in a racist society. And when we leave anti-racism drives and initiatives and agendas down to charities and ad hoc, and not saying actually as a government, this is going to be part of our agenda because it needs to be tackled in order to help communities, we're still going to be dealing with a small fish in a big pond, if that makes sense.
I 100% agree. I think there's amazing places out there that support communities like this, especially Black Minds Matter. They are doing so much at the moment to make sure that access is out there and readily available, and that you have the support. I think, reach out to the people around you. Make sure you have good, strong relationships, and you have people that you can turn to when you are in a time of need.